Let's move on now and talk about our primary cardiomyopathies. So now, very important, when you say cardiomyopathy, what you're saying is there is a disease intrinsic to the myocardial fibers. Because up until now, we've been talking about problems either with the blood vessels, valves, and those type of things. Now, the problem is specifically with the myocardial fibers. So again, we're going to compare and contrast the three major types. The first one we're going to talk about is called dilated, okay? Very important. There's dilatation of all four chambers. Sometimes they'll describe the heart as being large and flabby or floppy looking, okay? Now, very important causes. Alcohol is an important cause. Post-viral infection. And as you know, the most common infection, viral infection of the heart is Coxsackie-B. To be aware of that. Of course, drugs can cause it. Again, you know, drugs basically can cause anything, right? So adriamycin is a classical one, and also may be associated with pregnancy. So those are the classic diseases that give you dilated cardiomyopathy. Now, what's the problem? The problem is that the myocardial fibers have decreased contractility. That's very important. So why? What happens? Now all the blood pools in the chambers. And to compensate for all the increased blood, the chambers dilate. Now, what happens? Number one, you get decreased cardiac output. However, the other thing they'll ask you about on the step is you get a decrease in your ejection fraction, right? Decrease in your ejection fraction. Normally it's around, 55, 60%. Now it goes down to like 25% and lower. I actually was in the awards one time as a junior student, and I was in ICU. We had an alcoholic in the ICU, and he had ejection fraction of about 15%. I mean, I don't know what they were using, holy water, whatever, keeping that guy alive. However, as you see here, very important, decrease in your contractility is important. Again, decrease in ejection fraction, and these patients are going to present with congestive heart failure. That's what you want to remember, okay? And they're very important. We're going to compare this to the other two different types of cardiomyopathy. Now, hypertrophic is one you've probably heard about if you know that it was this disease. This is the one associated with your typical young male athlete who suddenly passes out either on the basketball court or playing football or playing hockey or soccer or some type of event like this, okay? However, on the step exam, they know it's typically associated with some type of exercise like football or basketball. So what we've seen sometimes on the exam, they'll put a patient playing racquetball or playing tennis or that kind of thing. But the point is they're doing some type of exercise, it could be on the Stairmaster or whatever, and they suddenly collapse, okay? So let's talk about what the problem is. And number one, we're talking about it being autosomal dominant. And the key is you have hypertrophy of the septum and of the left ventricle. Now, hypertrophy of the septum and the left ventricle gives you the so-called banana-shaped chamber. Sometimes you see that on the exam. However, the problem really is the septum, because the septum actually causes obstruction of the ventricular outflow tract from the left ventricle into the aorta, which is why the other name for this used to be called idiopathic hypertrophic subaortic stenosis, because the septum is obstructing the blood flow. And that's what gives you the syncopal episodes and the sudden death. That's very important to understand with this disorder. Also, the patient will have myofiber disarray and interstitial fibrosis. So again, there's a problem with some of the contractility of the fibers. So again, very important, you have this hypertrophy, most prominent in the septum, causing ventricular outflow tract obstruction. That's very important, okay? And again, like I said, myofiber hypertrophy and disarray along with interstitial fibrosis is what you will see microscopically. And in fact, recently there have been some athletes who in the past year or so playing hockey and soccer who have actually passed out and died while playing their sport because of this hypertrophic cardiomyopathy. So be aware of it. The third one and final one is called restrictive cardiomyopathy. What does that mean? It means you're restricting the movements of the ventricles. Now, very important, these patients have normal contractility in contrast to dilated cardiomyopathy. The problem is something's infiltrating in the heart, restricting these movements, and now the ventricles cannot expand during diastole and fill properly. So sometimes you might see it described as the chambers have lost their compliance. Again, cannot fill properly during your diastole. So what can do this? Well, amyloid can infiltrate. So again, Congo red stain, apple green birefringence, cross beta pleated configuration can come up with that question. Sarcoid, because of non-casein granulomas, can infiltrate into the heart. And again, these last two, the key is that you get fibrosis and inflammation, again, going to the fibers. But the key is the chambers cannot expand, so the patient will present with biventricular failure, okay? Sometimes you can actually see it on echocardiogram. So they may present it with a patient with echocardiogram showing that you've lost compliance of the chambers being able to open because of the infiltration of the substance into the fibers. Now, one thing I will mention is that clinically, a patient with constrictive pericarditis can present just like restrictive cardiomyopathy. So what does it mean when I say constrictive pericarditis? What I'm saying is something is around the heart constricting the movements. Scar tissue, metastasis, okay? Patient may have a history of radiation to the chest for like Hodgkin's disease, and now they got scar tissue around the heart. But the point is, in either case, again, the chambers cannot fill during diastole, so patients with constrictive pericarditis will present clinically just like patients with restrictive cardiomyopathy. So be aware of that.